Buccal Fat Pad Removal. You might have heard a lot about it. Supposedly the procedure that all celebrities are getting. But what exactly is it, and is it right for you? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery, Bangalore. And today we will talk about Buccal Fat Pad Removal. So firstly, what is the buccal fat pad? In the face, there is fat at various layers. You have something called subcutaneous fat, which is just below the cheek. You also have something called the buccal fat pad, which is deep inside. It is so called a buccal fat pad because it's like one encapsulated mass. It's not a diffuse area. It is deep in between the muscles. And it extends all around your cheek and upwards into almost your temple bones. And this is what contributes to the heaviness of your cheek. And this is known as the buccal fat pad. Now, what is buccal fat pad removal and why is it done? Buccal fat pad removal is a surgery wherein we make a small cut in the inside of your mouth and this fat pad is removed. It is done to give thinner cheeks. Particularly in models, if you're looking for that kind of sucked in appearance of the cheeks, this surgery helps to provide that. It is also favored because it is a relatively safe procedure. Trying to remove the fat just below the skin is risky because there are a lot of nerves and blood vessels. This buccal fat pad, you can go inside from inside your mouth and you can remove it safely without causing damage to any other structure. And that is why this is becoming popular. Now, who is a candidate for this? The best candidates for these are people with heavier cheeks who want to have slimmer cheeks. Now, heavy cheeks can be many things, so which is why it's important to identify the patient properly. Heaviness over here on the bone, that is not buccal fat pad, that won't help. Heaviness back here over the muscle, that is again not buccal fat pad, that won't help. Heaviness in this area in the front of the cheek is where buccal fat pad removal can help. The best patients are those with a slightly rounder face who want to have a flatter face. Those who already have a flat face who want to get a sunken face, that it's a more tricky situation. Those patients have to be identified properly because while it might look good early on, as you get older, your face might start looking worse. As you get older, a very empty face might not look so good. So it's important that your plastic surgeon guides you whether you're a good candidate for this procedure or not. Now, how is the surgery done? This is a simple surgery. It can be done under local anesthesia, or if the patient is nervous, it can be done under general anesthesia also. Typically what we do is, we make a cut inside the mouth. We have to make this cut in a specific area to avoid damaging any structures. Then we open out that area, find the fat pad, remove it, and we just cut it. So, this is a very easy procedure. It hardly takes 15 minutes when done by someone who knows what they're doing. After that, a couple of stitches are put which are absorbable, and the patient goes home the same day. There is no admission. So, what is the recovery after this process like? Your face will be very swollen for around 4-5 days. Typically, after 5 to 7 days, no one gets to know that you had something done. You feel pretty normal from the next day itself. You can work on a laptop, work from home within a couple of days itself. But for you to show your face and people not to know that something was done, that takes around 5 to 7 days. After 7 days, as the swelling goes down, you slowly start seeing the result. The full result typically takes around 6 to 8 weeks. Now, is this a safe surgery? It is a very, very safe surgery. But any surgery, there are complications which can happen. Now, these can be complications which are possible with any surgery or specific complications related to this surgery. General complications include infections, include bruising, and these are risks of any surgery. They are very, very low, but they are not zero, and your doctor should take all precautions to prevent them from happening. The other types of complications are by those who don't know what they're doing and they don't do this procedure properly. If you don't do this properly, you can cause damage to some of the structures. There is something called the parotid duct from where saliva comes. If that is damaged, you can have difficulty producing saliva. If you don't know what you're doing and you cause damage to a facial nerve, that can affect how your face moves. So these are all problems that happen if you get this done by an inexperienced surgeon. So what is the take-home message? This is a good, safe, simple treatment, but it should be done by someone who is experienced and it should be done in the right patient. It is not something to be done for everyone. So make sure you see a surgeon who is experienced in this procedure. I hope you enjoyed this video. Do like, share and subscribe to our channel. Let us know in the comments what you think about this procedure. Thank you. Have a good day.